Hello, I'm Dr. Nathan Faulkner, an orthopedic surgeon that specializes in the treatment of the shoulder, hip, and knee.
And I'm Kara Cohn, his physician assistant.
Today we will be demonstrating some important components of your care with some video segments. At the time of surgery, you will be given a nerve block to help control your pain after surgery. The nerve block usually lasts 12 to 18 hours. Once the nerve block has worn off and you have full feeling and control of your arm again, we want you to remove the sling at least 3 times a day to do the exercises we're going to demonstrate for you now. The first of those is elbow range of motion. So once the sling is off, fully straighten the elbow and fully bend it 10 times, 3 times a day. It's very important that you get the elbow all the way straight, because if you only go partly straight, the elbow muscles can contract and scar down, preventing you from fully being able to straighten your elbow. Next, we want you to do wrist range of motion exercises, again going all the way back, all the way forward, and this helps prevent the wrist from getting stiff. Again, do that 10 times, 3 times a day. Finally, the exercise ball that's attached to your sling can be removed, and you should squeeze the exercise ball multiple times a day to help promote blood flow in your forearm and help reduce swelling. Depending on what surgery you had, we will have you start what's called pendulum or Codman exercises, which we will demonstrate now. To effectively do these, you want to find something that's stable that you can lean on with your non-operative arm. Then you bend over 90 degrees at the waist and let the operative arm just dangle in front of you. Then we would like you to start gently going forward and backward, and you do that 10 times. And notice how Kara is not swinging her body or doing very large movements. Your arm is supposed to just hang freely, almost like an elephant trunk, gently moving forward and backward. Then we would like you to move side to side. Again, 10 times, gently. Then you can go clockwise in small circles, 10 times, and then counterclockwise, again in small circles. As you progress and as your shoulder starts to feel better, you can start making larger revolutions and larger movements. But again, we don't want to intentionally position the arm in space or do such large movements that our whole body is moving. Later on in your recovery, we will have you start some additional exercises. One of these is wall climbs. To do a wall climb, face the wall and position your hand on the wall in a comfortable position. Then gently start to climb up the wall. And you go until you start to feel some pain. At that point, you want to try to hold that stretch for about 10 seconds, and then you can come back down the wall. Then we want you to go climb again. Again, going until you feel some pain and hold it there for 10 seconds. A little bit of pain is good. A lot of pain, you should maybe not stretch quite as much. That's the wall climb going forward. Then you want to turn to the side. And again, position your hand on the wall in a comfortable position and climb up the wall. Again, going until you feel pain and then holding it there for about 10 seconds. As you start to recover your shoulder range of motion, what you want to do is start to walk towards the wall. So as you get up higher and you feel like you've reached the top of your climb, you can start to walk towards the wall to get an additional stretch. To stretch your arm in external rotation, we recommend that you put something between your upper arm and your chest, like a towel roll. This is very important because you want to focus on keeping your upper arm against your chest as you do this stretch. And to do this stretch, you put your hand against a door jamb or the corner of a wall so that your arm is about 90 degrees from your torso. And then you start to turn away from your arm to get a stretch in external rotation. You want to go until it hurts and hold it for 10 seconds. You'll see why having that towel against your chest is really important, because as people, if they have stiffness in external rotation, they try to compensate by raising their elbow away from their chest, and then you won't get an effective stretch. But this towel kind of helps you focus on keeping your arm against your torso so that you can get a good stretch in external rotation. Again, do 10 reps 3 times a day. To stretch an internal rotation, we recommend using the strap from your sling, but you can also use a towel. And what you want to do is take the strap and drop it from your good arm down to your operative arm, and then pull up with your good arm to get a nice stretch in internal rotation. You want to go until it hurts and hold it for 10 seconds, and then you can relax and do it again. Again, pulling up with your good arm to get a good stretch with your operative arm in internal rotation.